individual countries what exactly is to be done in every single context. What we do advise is anywhere where people gather, where they cannot maintain social distance or physical distance or appropriate hygiene, then there's always a risk in the presence of the virus that you may amplify the virus. And we've seen that, and there's plenty evidence that has happened in the past. So as countries open up their economies and open up their societies, and as they look at different gatherings, be they religious or social gatherings that occur, they've got to calibrate the risks associated with those gatherings, which are based on how much virus is circulating in the area. So what is the absolute risk of exposure? And then what are the increased risks of being exposed in an environment where there are a number of people who cannot maintain physical distance or potentially maintain hygiene or other measures. And you can see within that many governments and companies, private and public, are looking at what are the measures that need to be put in place in, for example, restricting access to less than full capacity or some proportion of capacity, to having spacing between seating, to having extra hygiene and disinfection measures put in place, having online ticketing. There's lots of different measures that for each individual service or each individual gathering can be put in place. The same with churches. So again, as the Director General has said in his speech, exiting the more severe public health and social distancing or physical distancing measures or the lockdowns or stay-at-home orders and allowing people to re-engage in social and economic life must come with a risk-managed approach. How do we minimize the risk of transmission between individuals while obviously trying to maximize the way in which people can re-engage in their normal lives? And that is determined by the presence of the virus, that is determined by the risk of the encounter or the risk of the particular environment in which people will come to, and the means and the ability of both the government, local governments, communities, and private sector owners to minimize those risks to participants or to clients.
Thank you very much, Dr. Ryan. Next question comes from Italy, Luca Rossini from RAI. Luca?
Hello, can you hear me?
Yes, please go ahead.
Okay, so regarding the contact tracing, what would you suggest to country like Italy to integrate manual and digital contact tracing in order to speed up not only the national process of contact tracing, but even the broader process of international process of contact tracing, which is very important when the border will be opened again?
Thank you, and I think this is a challenge that's facing many countries right now. So I won't answer it in the specific context of Italy. I think when you speak to professionals in Korea and Singapore about what they did to make their contact tracing more effective, they will first and foremost tell you that they got more boots on the ground, that they went back to the basics of public health. Finding cases at community level, community-based surveillance, putting more surveillance officers out there, following up with people, making the phone calls, knocking on people's doors, finding out who could have been exposed, and ensuring that those who are suspected are tested and isolated, and then ensure that those who are in contact are given that information so they can protect themselves and their families, and are offered either home quarantine or quarantine in a third place. And this has all been aimed at breaking the chains of transmission. If someone who is infected has no further contact with other people other than protected health workers, their chances of passing on the disease are minimized. If a contact who is developing disease is aware of that and reports symptoms immediately, the chances of them infecting someone else decreases very, very importantly. And this is all going to that number that everyone talks about, the R number or the R naught, the capacity of one individual to infect any other individual. Contact tracing and case finding is not about surveillance or interrupting people's lives. It's about trying to identify those individuals who are sick and in trying to ensure that those sick individuals are tested and cared for, and that anyone who is in contact with them is monitored and then subsequently tested and cared for if needed. In doing that, we reduce their role in spreading the disease to others. That is essentially a human process, and it needs to have a human face because these are difficult times for cases and for contacts. What has emerged, and what WHO, for example, for a number of years has been working on a system called GoData, which is an integrated information system, which is app-based, which allows public health authorities to integrate all of the different data, the case data, the contact data, the laboratory data. And we've rolled that out to a number of countries over the last number of months and with increasing frequency now during COVID-19, and are willing to offer that to any country that wishes to implement it. The addition of apps that people themselves can have on their telephones that will give them information on their disease status or notify them if they've been in contact with an individual that is infected can obviously enhance the effectiveness of contact tracing and surveillance. And we've seen various examples of that emerge around the world and be put to use. They are an additional measure that will potentially enhance the efficiency of the contact tracing process, but they won't do it by themselves. In doing that, and we're very grateful for those countries and those companies and those innovators who are working on such tools, and we're talking with them every day. What we need to ensure as we roll out those tools, number one, that they enhance that process, and they're not seen as a replacement for shoe leather epidemiology. They're not seen as a replacement for the basic human workforce, the army we need to go out there and find cases. They can enhance the work of that workforce, but they can't do the work of that workforce. If we add those tools and give an extra boost to that process and become more efficient, then we'll get rid of this virus more quickly. But we also have to consider, and very carefully within this, that these tools must be used for that purpose and that purpose alone. And we have to take into account people's personal data protection of their data, protection of their privacy, and ultimately protection of their human rights. I think all countries are trying to approach this in a very balanced manner, but we do believe that such tools are useful. We're very, very grateful to see the innovation, but we are very, very keen to stress that IT tools do not replace the basic public health workforce that is going to be needed to trace, test, isolate, and quarantine.
Anna?
Yeah, hi. Thanks for taking my question. I'll ask in Portuguese, so you provided the translator. Nos últimos dias, alguns dados têm mostrado que há países que não têm só uma curva da doença ou da infecção por coronavírus, mas duas curvas. Uma curva que está se achatando mais rapidamente, que é a dos habitantes mais ricos ou com mais recursos, e outra curva, que é a curva dos mais pobres, que continua crescendo. Eu gostaria de saber se essa é uma preocupação da Organização Mundial de Saúde, se vocês têm registrado esse fenômeno em outros países e se isso pode ter alguma influência nas políticas públicas adotadas nesses países, quando as populações mais vulneráveis têm menos poder de agenciamento, menos voz dentro da formulação das políticas públicas. Obrigada.
Maria may go into the detail, but I think it is as to whether or not we're seeing this phenomenon. But it is very important, and the Director General has said this many times, public health surveillance and testing is available to all who need it. And it is very important that test the purview of the wealthy or those who can afford it. This isn't about testing people from a clinical perspective only. This is about testing people so we know where the virus is. And therefore, if people see the purpose of testing in just getting my diagnosis so then I can go and pay for treatment, then that is a distortion of the ultimate purpose of testing. Testing is aimed at doing two things. One is giving people with